Thank you for joining us for our second session of our LEA series here at ESU 13 on the Nebraska Department of Education Special Education Guidance. This particular session is on occupational therapy, physical therapy, adaptive PE, and sign language decisions. Do note that all of the material that is put into this presentation and is being offered today is a summary of current guidance offered by the Nebraska Department of Education. We are not adding any additional information. We are just simply following the guidance that the state has presented and offering that to you for your school to make decisions for policy and practice. So we're going to get started today and talk about the use of OT and PT services within our schools. And first, we're going to examine the purpose of the occupational therapy and physical therapy services based on the document that the Nebraska Department of Education provided. We have to remember that the primary purpose of the document was to offer the scope and application of occupational and physical therapy services to the schools within the state. We find the reasons for the document and the state decisions based on three main legal components. First, we find it in Section 504, and the occupational therapy and physical therapy services are provided to ensure that there is not any discrimination based on a disability status of a student. We also note that if the student has a mental or physical impairment, that we should provide services to help support them. Then we also know that if they have a record of the impairment and physically have the impairment, that services affecting major life activities such as caring for oneself, performing regular tasks, daily tasks, walking, seeing, hearing, speaking, breathing, learning, and working, that they are covered and protected under Section 504. Rule 51 also states that occupational therapy and physical therapy services relate to 3.49, where transportation and such developmental, corrective, or other supportive services are required to assist a student with a disability. We even have it specifically noted within Rule 51 that physical or occupational therapy can be provided to youth. It does not include a medical device that is surgically implanted or the optimization of the device's functioning. So when we're talking about a need, we have to remember that that's not a specific need for occupational therapy or for physical therapy. However, that may fall within another category under Rule 51. It also is within Rule 52. We have to remember that some things are very different from Rule 51 to Rule 52. So 3.06B9 identifies that services, if a student needs services to address the functional needs of an infant or toddler with a disability related to adaptive development, adaptive behavior, play, sensory, motor, or postural development, that we may need the use of an occupational therapist. In addition, 3.06B10 identifies that we may need a physical therapist for students under the age of 3 if they need services to address the promotion of sensory motor function through enhancement of the musculoskeletal system, neurobehavioral organization, perceptual and motor development, cardiopulmonary status, and effective environmental adaptation. We have to identify if movement is a concern, and we look to prevent, plan, and alleviate for motor dysfunction. Then we also have to look for other functional concerns that may be present. So there is a difference between the Part B and Part C language. So now that we know what specifically is stated under occupational therapy and physical therapy within the law, we're going to look at what NDE identifies that the services may include. So an occupational therapist is one who assists individuals who may be limited with mobility. They may have psychosocial dysfunctions. They may have developmental or learning disabilities, or the aging process in order to maximize independence, prevent disability, and maintain health. So occupational therapy in general has a lot of different areas that they may support. The document that we are examining today identifies that occupational therapy skills and services within our schools may include the teaching of daily living skills and being able to progress through those, the developing of perceptual motor skills and sensory integrative functioning, developing pre-vocational capacities, designing, fabricating, or applying selected orthotic and prosthetic devices. So what we want to remember about that is a lot of people think that occupational therapy includes therapy related to an occupation. It is one of those components to work with pre-vocational components, but it also is about living skills, motor skills, and sensory integration. We use specifically designed therapeutic services to ensure that the functional performance of each student within those categories that we talked about can be enhanced. Then we administer and interpret tests such as manual muscle and range of motion. So when you're in an MDT meeting, you may hear about the gross motor skill assessment that they have completed. They also work on fine motor assessments within our schools. And then we look at adapting those environments for the students who may have verification of that disability. Occupational therapy should be provided in our schools by one of two individuals. An individual with an occupational therapy degree, which is a graduate of an accredited education program. They either have a master's or a doctoral degree and have the occupational therapy license for the state of Nebraska. Sometimes we may have an occupational therapy assistant, which we call an OTA. That individual is also a graduate of an accredited education program. So it cannot be an individual who has not received education within the occupational therapy area. They attend a specific program to become an occupational therapy assistant. So we have to remember that they always work under the supervision of an occupational therapist. Any questions so far about the scope of practice and the education requirements for occupational therapists? And a physical therapist, we may note that they actually have similar focuses within our educational teams. And when we're in IEP meetings, sometimes it's difficult to identify which individual should be supporting one of the components that needs to be enhanced. Because if you look at the definition of a physical therapist, it is very similar to what we talked about for an occupational therapist. So we have services to address the promotion of sensory motor functioning, the enhancement of musculoskeletal status, neurobehavioral organization, perceptual and motor development, cardiopulmonary status, and effective environmental adaptation. So if we compare those side by side, we see a lot of similarities. And even going further into the bottom component of the slide, it's the exact same thing. We screen, we evaluate, and we assess. So we really want to think about what is the key difference between them and what services does a physical therapist provide that maybe the occupational therapist does not. So
Pam, your camera went off. I don't know.
Okay, thank you.
Mm-hmm.
There we go. Thank you. Okay, so when we examine, we evaluate, and we test individuals with these needs. That is very similar to what an occupational therapist does. And so we think about that, and we think about that their services could be similar to that. That's why, as an LEA, we should know when we're in a decision-making team where we come together and talk about the assessments that we're going to be giving, we want to make sure that we're getting a full spectrum of those assessments, and that each individual that may be on the team is going to be giving an assessment that will give us information that enhances all of our other scores from the team. But what we note is there are a lot more things that a physical therapist may do that an occupational therapist does not. While they focus on the same things, physical therapists often provide therapeutic exercises for youth. They will also train paraprofessionals or individuals in our school to ensure that those therapeutic exercises are given on a normal basis. We have functional training in the home, community, or work integration to make sure that they have mobility. For example, we've had a student in the past who struggled with their physical walking and their mobility. And so the physical therapist trained the individual to use a little scooter to be able to move freely and be able to get to the course. We have therapeutic massage. That is something incredibly different from what the occupational therapist will provide. We have mobilization or manual therapy, recommendation, application, and fabrication of assistive, adaptive, protective, and supportive devices. Airway clearance techniques. So if we have students with more significant disabilities who maybe have swallowing concerns, or they have needing to sit up, or their wheelchair maybe doesn't allow them to sit up and be able to have that airway clearance, they may teach us those techniques to support us in the healthcare of that student and ensure that they are able to breathe in an appropriate way, or their wheelchair is fitted appropriately. We have protection techniques. How can we protect them from sores? How can we protect them from other components around them that could hurt them? Non-surgical wound care. And that's if maybe a student has just a wound that is related to sitting, or they have a wound that maybe their orthotic may be rubbed on their skin. So they can provide us some of that information. Physical agents or modalities, mechanical and electrotherapeutic modalities, and patient-related instruction. So they come from that more medical perspective of talking about the massage and the muscular system and moving through our school environment. They may purchase, store, and administer topical and aerosol medication in compliance with applicable rules. So that means that if we have something that we are caring for, they may actually get those items and provide those items. They help us reduce the risk of injury within our school system. If we know that we have a student who has limited ambulatory abilities and maybe it's within their right leg, they can help us set up our environment to reduce the risk of falling, trips, injuries. They engage in administration, consultation, education, and research for us. So physical therapists, even though the description and the definition is similar to an occupational therapist, they do have different roles within our schools. And this is very similar as well to the occupational therapist, where a physical therapist will undergo a graduate program to become licensed by the Board of Physical Therapy. So that individual typically has a doctoral degree. Physical therapy assistants, PTAs, are a graduate of an accredited education program, but they have a specific program that focuses on supporting physical therapists. And so it isn't just an individual within our school that we can train to be a physical therapy assistant. They have to be a graduate of an accredited program. Any questions about the role and scope of the physical therapist? Okay, I wanted to put this section in here. They have it within the guidance document, and it's important for us to know about paraprofessional use related to occupational therapy or related to physical therapy. So the paraeducator is very different from an OTA or a PTA. We talked about that a little bit, but we need to know that they are not specifically trained to be an occupational therapy support assistant or a physical therapy support assistant. But the classroom paraeducator can have ongoing communication with those therapists or those assistants regarding the student's performance. They can follow through with activities that are developed to support the student. So if there is something that is needed daily, one example we previously gave was massage, then they could do those things. They could do motor activities. They could do those items. They can do handwriting activities. They can support those things. We just have to remember that all activities would be supervised by an occupational therapist or a physical therapist, that the paraeducator would not be making the activities up or developing the lessons and focus of the activity time with students. And when we think about what is required and talking about that paraprofessional role and having them support that, we come to the service decisions. We talk about those in our IEP meetings. We talk about those in our MDT meetings. When a student qualifies for special education and we have services needed for occupational therapy or physical therapy, we have to make sure that we are talking about what that looks like. We have to first identify that a disability is present, and then we have to identify the unique needs which actually make occupational therapy and physical therapy required for that student. So the occupational therapist or the physical therapist might provide some interpretation of the educational implications, but it's the team's decision to talk about if that student has a unique need which significantly interferes with the child's ability to participate in the educational program. And so not every child with a fine motor deficit may need occupational therapy support. So that's where the team comes together and decides if that student as part B needs that specific support and service in order to access their educational program. Any questions on that? Okay, Part C is different than our Part B for occupational therapy and physical therapy. While we have to have the presence of a disability, we have to also identify how the need would contribute to a developmental delay. That one is a little more open because it could be related to a lot of different components. So if we have a young child who has some sensory needs and we're not 100% certain where those sensory needs are coming from, we may want an occupational therapist to be on the team to provide some services to us to help with that sensory integration. So we have to remember that they will provide that interpretation of the developmental implications, and they will recommend some developmental needs within our school. Now, it's a little bit different in Part C because we can have clinical decision and clinical components that come into that, where in Part B, we have to look at all factual realms of the educational setting and look at those. Any questions on the difference of Part B or Part C? Okay, so our evaluation, the things that we do for occupational therapy, physical therapy for all students, we conduct interviews and ecological assessments. So we can bring in observations of home environments, opinions, anecdotal information that we've seen happen. Maybe the student has tripped several times when going outside on the stairs. We can bring those type of ecological assessments and through anecdotal information observation. We also can use criterion reference, norm referenced, or curriculum-based measures. So we could have the physical education teacher provide some curriculum-based activities. They often log how students are doing, and they have lists of basic movement and motor skills that students usually have at the ages they are. We could bring that to the table. We can do assessments. We can have the physical therapist or occupational therapist perform assessments as well within the MDT process. That's for all. All of those are present with either 3 through 21 or under age 3. But the thing we need to know is that there is some difference for that identification between 3 through 21 and birth to age 3. So for 3 to 21, we review records, we look at the school system, we look at students' works, we take work samples, and we review the pre-referral procedures. So we have documentation regarding what we have done and how that has worked within the environment. Maybe if the student is struggling with handwriting, they completed a handwriting program and that has not improved. We would document exactly what we did, how we did it, how long we did it for, and if we saw growth and improvement. Maybe the PE teacher, the physical education teacher would identify how long they worked on each activity, maybe the growth of that, maybe they have data reports, but those kind of things are important to bring to the table of what have we done to make sure that we have given 100% access for that student. Then for children birth to age 3, we don't have school records, so we look at medical records. We look at human and health services documents, and we might look at other CAPTA information. And that's where informed clinical opinion can also come in for children birth to age 3. Any questions on the evaluation for students for OT and PT? Okay. Once the child is determined eligible, either the IFSP or IEP team will move to get all of that information together and come up with what we call prioritized concerns. Basically, those are the concerns that we feel are significantly impacting our children from the school and educational setting in Part B, or things that come to the developmental delay or stop their access to life skills and growth elements for those in Part C. So we use these main prioritized concerns to come up with annual outcomes and goals. And so what we have to remember when we're building the goals and we're building the support systems for our students regarding occupational therapy and physical therapy services is that the need has to be primarily those that can be addressed in the OT and PT scope of services. And so if you have questions on that, you can go back to the slides that I had of what that scope actually looks like. So you will have a copy of this so that you know exactly. So that if it's something within the scope of the occupational therapist, maybe we only need an occupational therapy goal. Maybe if physical therapy and those significant life skills medical components are not needed, we may only need an occupational therapy goal. Or we may simply need a physical therapy goal. And so we want to talk about it has to be something, the goal needs to be something primarily related to the scope of practice of that OT and PT that uses the unique expertise of the OT and PT and isn't something that school staff can provide alone. So there is a potential for positive, progressive, and functional change. If we have a student who is not making progress after 8 years' time, the team may want to have a discussion about, is there a chance and a potential for positive, progressive, and functional change as a result of these goals? Because if our goals are not working, we should be changing them annually anyway. But then we have discussions about, is this going to have a positive impact? Then it appears that without the specific related service, a negative change would occur. So we have to make sure that it is so critical that without this related service of occupational therapy and physical therapy, that a negative change would occur. The student would regress, or there would be a health and safety concern, or there would be something related to that. So we just have to address key concerns, make sure that it is primarily related to the scope and sequence of that particular related service, and just make sure that we have reasonable expectations that we can have growth and that we can have the student develop positive impact through that service and outcomes. And we have to remember that they need to be written in measurable and discipline-free terms. So we have to think about how are we writing these goals to make sure that they can use this service within the general education environment. So we would want them to be able to move freely about the school in a safe manner. We may have that therapy and that massage piece as a part of it, but we cannot write, will receive massage 5 of 6 days. That is not a goal that leads to an outcome that goes for what the purpose of occupational therapy and physical therapy actually is. So we just have to remember IFSPs focus on the natural environment and IEP goals focus across the school. So as long as those outcomes and those goals can have a positive impact on either the natural environment in that Part C IFSP world or in the Part B world, that they have a positive impact on the educational access of children. We also want to make sure to have a discussion about service time and the method of services. So the Nebraska Department of Education identified that services of the occupational therapist and physical therapist must have appropriate frequency, intensity, and locations to meet the outcomes or goals of the child or student's IFSP and IEP. So we have to remember the natural environment for that IFSP and across the entire curriculum for that Part B. Do those specific goals and outcomes help that student achieve that? What recommendations did the OT or PT consider? And did we discuss that as a team within the context of our outcomes and goals? If we want to ensure that a student is able to have strong social relationships and we're having work to build that, but the student isn't able to access the playground stairs safely, we would want to have a goal to access stairs. So we have to remember that that helps us achieve that goal. So we have to think about what our outcomes and our goals are for students, and then we connect those. But the ultimate determination about amount, frequency, location, and duration is part of the LEA team. So it isn't decided by the occupational therapist or the physical therapist, it's decided by the entire team. And that location is the big thing I want you to note. A lot of it we should be doing in that inclusive environment if possible, because that's what our typical goal, outcome and goal is for students. So we want to think about what location is that done? How often does that need to be done? Can they provide a paraprofessional some support to be able to know if that's something that can be done within the classroom? We may need them on a consult basis. We can do that within an IEP. Remember that an occupational therapist or a physical therapist cannot be on an IEP without another disability category. And that's something we hadn't talked about with that identification, but we can only have those services if we have another categorical verification for that student. So we have to think about how we're connecting them with all of the other services that that student is receiving. And neither the assistant of the OT or the assistant of the PT, those professional organizations, they do not indicate any set standard of what best practice service and amount looks like. So we don't have a set amount of time that is required. We don't have a certain type of service. That is solely a decision of the team to encourage the access of the student for the environment. So remember that service time and method decisions are natural. They should be given in the natural and least restrictive environment as possible. So if we could embed them into the classroom, that would be desired. Desired outcomes and types of skills to be learned should be noted. We should know exactly what we're working with and why we're focused on it. The extent to which the disability interferes with the child or student's developmental or educational program should be noted, because we are only bringing them in if it impacts the student's access to the education. And then anticipated potential improvement with the intervention. We need to know that there is anticipated improvement and that we're not having that service on for a long term if it's not going to have the positive impact that our team hopes. Level of expertise required for strategies and methods. So we need to talk about that as a team. We need to, as an LEA, encourage that discussion. Who can do this? How do we do this? And what is the best way to do this? And then the need, ability, and availability of others to carry out the student's program. Who can we connect if it is something that doesn't require the true expertise of a PT or an assistant of a PT or an OT or an assistant of the OT? Who can we bring in? Is this something we could train someone to do within the school? So the IFSP and the IEP have these requirements for documentation of the specific services. But the teams and you as the LEA need to make sure that we're having the discussions noted around those top components. We may choose consultation, we may choose collaboration, we may choose coaching or other methods of providing these services. There is another piece of the IEP as an LEA rep to remember to bring up. If that individual is receiving those services, occupational therapy and physical therapy qualify under MIPS reimbursement. And so just having the consent form signed if the individual does qualify under MIPS reimbursement for schools. If we choose to discontinue those services, either we identify that that a positive impact may not change because maybe the structural makeup is that, and we've tried to increase the flexibility, and we've had 4 or 5 years of working on that, and we haven't been able to do so, we may choose to discontinue services. Or if we identify that the student is able to freely use their fine motor skills to complete assignments, we may not need occupational therapy. In that case, the team can discontinue those services if the potential for further change appears unlikely. And we just want to state that in the MDT forms and in the IEP as to why as a team we've identified that they do not need this service any longer. Okay. Any questions about occupational therapy or physical therapy services and decisions based on that? I'm looking just to see if Jessica has joined us. I know she was in another meeting. So we are going to proceed, and then if she comes on, we will definitely have her take over. So the second guidance that we're going to review, it will be reviewed quite quickly because the rules for it are clear. As always, we look at the law and how it is identified within the law. IDEA, through federal law, specifically identifies that we have to have instruction in physical education. So you will notice that in every IEP, we have to discuss that we have addressed physical education and the students' access to physical education. So when we look at that, that is why there is a specific guidance document for that, is because it is a key component of what special education is defined as. So federal law under section 504 states that a student should never be excluded or denied benefits of the educational programming subject to discrimination. So we want to remember that we have to look at a denial of physical education if our team discussed that the student couldn't access that physical education class as we have it laid out. that actually can be a denial of Section 504 of the Rehabilitation Act. So that's why we open the discussion to adaptive physical education. So we have to remember that in all programs, activities, and services is how it is defined. That means schools fall within that law. Nebraska law under Rule 51 goes further to identify that all students should have access, equal opportunity and access to regular physical education programs, unless the child is enrolled in a separate facility or the child's needs specifically call for an adaptive system. If specifically designed physical education is necessary, it becomes the LEA's responsibility to ensure that the guidance from the Nebraska Department of Education is followed regarding adaptive physical education. And we have to remember that appropriate physical education services are offered. So we may try, maybe in the era of the we may try the we as an opportunity. But if we aren't using the students' mobilities and their access and their abilities to the greatest extent, we are not planning for an appropriate adaptive physical education course. So we want to think about that as we learn a little bit about this information. So the options that students with disabilities have for physical education include general physical education. Many of the students are able to participate with their general education peers in physical education courses. So if a student has a disability, but they are able to ambulate appropriately to be part of that physical education class, then they can be noted in that class. We want to make sure that we put that in our IEP and that we discuss that at the IEP meeting. It is specifically stated as a component of a disability, and we need to make sure that we put physical education abilities were considered and discussed, and the team chose to enroll the student in general physical education because they are able to ambulate effectively to participate with their peers. So we just want to remember that if it is specifically designed, if necessary, it must be available to every child with a verified disability receiving a free, appropriate public education. And in order to meet FAPE, we have to offer to students with disabilities the same that we offer to their peers. So if physical education is 3 days a week, the student needs to be involved in physical education 3 days a week. Now they can participate in their general physical education course with modifications or accommodations. This is where the occupational therapist, physical therapist, if they're on the IEP caseload with that student, might be a consult to talk about how do we modify and how do we accommodate for the student's motor needs, how do we accommodate and modify for the student's sensory needs, their attentional needs, because we want to make sure that the student is safe and that the environment is going to be a safe environment for the student. We'll let Jessica kind of log on here.
I see you guys and you don't see me. Just a second.
No, we don't see you, but do you want to take over for the adapted physical education slide on, and then I can move your slides?
Yes. Let me.
Can you see? Okay, there we go.
There we go. I had the wrong video input, or the old one or something. Who knows? So Pam, have you guys gone through the previous general
Yes,
PE
we
stuff?
did.
Okay.
So we're on this slide.
Okay, so this guidance document I thought was really fun to go through, and really was a good resource for providing to physical education teachers. The amount of resources this one has in it was just really impressive to me. So if we're thinking about a continuum for PE services for students with disabilities, beyond general PE with accommodations and modifications, kind of the next level is this adapted physical education. So this, whereas the general PE or that with modifications and accommodations was a general education service, when we get to adaptive PE, This is one of our direct services of special education. So one of the things I highlighted in the definition here also is that it's provided separately from PT or OT. So you would not have a PT or OT provider being the person to provide that direct service. Not to say that the physical education teacher certainly couldn't consult with those professionals or ask their opinion or get some modification ideas from them. But it really is the responsibility of maybe that physical education teacher, adapted physical education teacher, or a co-teaching kind of model there. Go to the next one. Yeah, there we go. And then kind of our most restricted environment as far as PE is concerned is the idea of self-contained adaptive PE. So this is specially designed. This is a separate class setting. And it's for those kids who are not able to participate fully or successfully in the general physical education setting. So this might be maybe a small class of only students with disabilities, only who need adaptive PE services, as opposed to maybe offering something in parallel with the general PE, or doing just adapted PE along with the general PE. So this is our most restrictive physical education option there. The next section that this guidance document talks about is just really how we collaborate and who all is involved in providing and designing those specially designed physical education services. This guidance document talks a lot about what is the role of your physical educator in that process. So one of the main points is that the learner outcomes for students in an adapted PE setting should be the same as for all other students who are in a general PE setting. So there's not, there doesn't need to be a separate list of outcomes or anything like that. It's just that we want them to work towards developing the same skills and have the same goals as our general education students. The abilities and the decision for what type of PE is one of the roles of that student IEP team. And so if adaptive PE or modified PE services is something that the team would be discussing, to really make sure to include your physical educator in that meeting as one of the general education teachers and as part of that team who has that knowledge and expertise in motor skill development. Some of the modifications that either the physical educator might suggest or that the team might consider, maybe that's adult support, maybe it's special equipment, smaller class size, peer models, or whatever that IEP team decides. When we are still looking at the role of the physical educator, so this person is the expert on motor skill development along with your physical and occupational therapist, but this physical educator would help you determine what instructional needs there are, how effective their typical instruction would be, and if the student might be able to participate in or benefit from that. They might help to develop some of those objectives as it relates to modified or adapted or accommodated physical education. They might also work with the parent or the nurse, PT, OT, special education, all of those people to learn more about what maybe specific medical conditions might limit in the physical education classroom. And then what support staff, really what the student is able to do and what might be appropriate for them given their physical needs or their medical needs. We also want to get recommendations from that whole team like we do for everything. So the PE teacher might be collaborating with PT and OT and getting information or ideas from the team about what really would be most beneficial in terms of gross motor skill development. There's one more slide about role of the physical educator here. So this is just that they are going to continue to promote social development and behavioral control for the special needs, just like any of our other general education teachers do. The middle point there is just about finding out when the IEPs are and attending those and things like that. And then if the PE teacher needs to be a part of that MDT or IEP paperwork, how they get access to that, how they learn about those modifications and accommodations as well. And being sure that they're I know a lot of times our physical educators are maybe also coaches or somebody that is gone at the end of the day when we have those IEP meetings. So being a proactive participant in getting the information from the IEP team about what was decided and making sure their input is heard. The next section in this guidance document talks about goals and objectives and how those are developed. In that guidance document itself, one of the appendices, I think, has some sample goals and objectives. So if that's something that you are wondering how that might be written or what that might look like, I would refer you to that guidance document because they do have some sample goals and things like that. One of the big things that this section of the guidance document talks about is assessment versus observation, and how we assess for the needs of students and if they might need adaptive physical education. And it really hits hard on that we want to do true assessment of the student's skills as opposed to just observing them and what they can do in a moment of time. And that we need to be truly administering some kind of assessment in order to develop those goals and objectives and see their potential and abilities, as opposed to an observation, which just gives us kind of what skills the student is using in that window of time. Then if you want to go on to the next one again, Pam, there are, this was interesting to me, just who can administer those assessments. So like any of our assessments, the assessment needs to be given by somebody who's trained and qualified to administer the test. So our first preferred person would be if the district has an adaptive PE teacher. If not, then we would want to see if the general physical education teacher could provide that assessment, just knowing that that is a person who has specific education and training in the area of physical and motor skill development. And then finally, if neither of those people are available, your special education teacher is able to administer those assessments. And that assessment information should be presented as part of the MDT or IEP to help determine what services and what kind of restricted or non-restricted environment those might be served in. Again, this document has some awesome appendices. One of the appendices in this document is sample assessments or ideas for assessments. I think they maybe list 5 or 6 assessments because this wasn't something that I knew common names of assessments for, but that guidance document gives 5 or 6 suggestions or ideas for assessments you might use. I think that is it. It's a very long guidance document. I think it is good, like I said, for the physical education teacher. There's probably 13 to 15 pages of definitions related to physical education. So I learned a lot there, not being a PT or physical educator myself. So.
Thank you, Jessica, for that information. Do we have any questions on adaptive physical education? Okay, so what I'm going to do is I'm giving Sarah the ability to control hers because she made a few changes. So we want to make sure that you all have that. So Sarah Peterson is going to talk to you about what the NDE requirement for sign language interpreters in your school actually is, and then that way to help you out when making those decisions in a meeting. So I'll let Sarah take it away.
I'm hoping you can see my slides up there. It is really wonky that when you're presenting, you don't get to see it how everybody else presents it. So if something is missing, please let me know.
We can see it and it looks good.
Perfect. Qualified educational sign language interpreters. So for the purpose of most of this presentation, we're just going to talk about interpreters who are going to be in your school building interpreting academic and social content for students. Let's see how I'm going to click here. Okay. So all of this guidance came out of the Rule 51 that was adopted on January 1st, 2017. So you'll notice some dates that we've added in here as other forms of rule have been passed through legislation. But looking at qualified sign language interpreters, to be a qualified educational interpreter, first and foremost, you must have a high school diploma, high school equivalency diploma or higher. And you must have received a passing score on the EIPA written exam That's an exam you take on the computer. It's about 150 questions long, and you receive a pass or a fail on that score. So once you have your high school diploma and you've passed the written exam, you must attain and maintain a passing score on one of these tests. So you can take the EIPA, which is the Educational Interpreter Performance Assessment, and receive a 4.0. You can have national certification through the Registry of Interpreters for the Deaf. You can have a 4 on the NIC, or the National Interpreter Certification Test, or you can have a 4 on the QAST. The QAST was a quality assurance signing test that we offered in Nebraska that is no longer offered. But if you have a 4.0 in that and you've maintained certification, we honor that. So you got your diploma, you passed your written exam, you got your test score, and you must have 24 clock hours of professional development logged in your file every 2 years. So all of that is an and. Now we come to an or. Or we might have a person who has that high school equivalency diploma, and now maybe they were working prior to that adapting Rule 51 in January 2017. So in 2017, we raised the bar from a 3.5 to a 4.0 on the EIPA. If you were employed the 2 school years prior to us raising that qualification bar, we've allowed you to maintain qualifications if you had a 3.5 or higher, if you were working those 2 previous hours, and if that entire time from 2017 up through currently, you have maintained those 24 clock hours. We've allowed you to stay certified in the state of Nebraska. So seems really easy, right? But what do we do if we can't find somebody who meets those qualifications? Can't find a 4.0. I didn't have a 3.5 when everything started. I can start over with someone new, and we always start them at a pre-hire qualification screen. So this is done through the EIPA pre-hire test. If a person comes in and takes that test and they receive a skills are where they need to be, or a hire with caution, they may be employed for up to 1 school year as an interpreter that is reimbursable in your school district. Or maybe we have somebody who took the EIPA but didn't get that 4.0. If they're sitting at a 3.0 or above, we can employ them if they maintain clock hours of training, which equals 40 clock hours every school year that they have been employed. And at the end of 2 school years, they have to retest and achieve that 4.0 on that test or get their RID certification. Part of that qualification, if you hire somebody at this 3.0 with this kind of 2-year waiver, they must write a professional development plan. And examples of those professional development plans are in that TA doc. That could be its own 30-minute webinar. So I did not throw those in here, but if you have questions about how to write a PD plan, we encourage you to reach out to the Central Western Nebraska partner. So let's say you have a candidate who comes in who is interested in applying to be an interpreter in your district. You want to make sure that you're looking at 4 different areas. Not only can they sign what they hear, can they speak what they see signed? You also want to check and make sure they have some deaf culture knowledge of some of the norms and characteristics of deaf culture. And you'd love them to have some previous interpreting experience. There's a huge difference between people who know how to sign words that they choose themselves and people who choose to have a career where they sign words that other people choose. So it's great if you can get somebody who already has that interpreting experience. Knowledge of sign language is not enough to qualify a person as a sign language interpreter under Rule 51. So if you have somebody who applies for a para position and they put on their application, we know sign language, that does not qualify them to immediately be a reimbursable interpreter in our schools. When we look at job applications, they're going to do the same kind of application as you guys would do for other employees in your district, but we want to make sure that you have in there a little bit of additional information. It'd be great if you knew their educational background and experience. If you could get a hold of their EIPA written and performance scores, or their QAST scores, or their RID certification, it would be great to have that as part of your application. It'd be great to know if they had any formal training as an interpreter, if they've already achieved certification, references of previous places or previous employers that they interpreted for, any special skills they might have. Interpreting for deaf and hard of hearing students is very different than interpreting for deaf blind students. So you may want to reach out and find out if they have any special skills or training in that area. And then you might also ask if they have achieved state licensure through NCDHH, or the Nebraska Commission for the Deaf and Hard of Hearing. And we'll touch on what that is right at the end of this presentation. School districts are responsible to ensure that educational interpreters have appropriate supervision. That can be very difficult to do if the administrators are not sure what the role of an educational interpreter should be. So we encourage you to have administrators to seek outside support to assist them in the evaluation of interpreter skills. And any of the regional coordinators through the Nebraska Regional Program can help you determine some of those evaluation procedures. Promotion and salary is always a big topic. Again, that's going to be based upon your school district's requirements and their process for evaluation and pay. But we do, this guidance document does recommend that you offer incentives to encourage those interpreters to get and maintain certification. Some places offer increased pay based on your evaluation, your degree, your licensing, your years of experience, and then if you have that national certification in your pocket. Then the guidance doc has lots and lots of pages about the roles and responsibilities of an educational interpreter. I condensed those down as much as I could and hit kind of the big highlights. Their primary role is to facilitate communication during the school day, as well as out of class and extracurricular activities. Their additional responsibilities are they share the responsibility for educating all students who are deaf, hard of hearing, or deafblind. This might include providing clarification for hearing students or other school personnel and parents. We want interpreters to participate in the IEP or IFSP plans as a member of the educational team. This does not mean they have to attend those meetings, but they need to be consulted because they have valuable input that should be included in those meetings. Some of that valuable input might be their knowledge of how that student uses the interpreter, how much adapting in the interpretation has to happen for a student to be able to participate in the classroom, or student behaviors and interactions that the regular classroom teacher might not be knowledgeable of because the interpreter gets to stare at one student all day long and the classroom teacher is responsible to monitor the entire class. We also encourage interpreters to work with members of the IEP, facilitate the IEP team to facilitate the evaluations and assessments. If a school psychologist is going in to do an intelligence test with a student, we want to make sure that that interpreter is consulted and utilized as an interpreter for that situation if that is what meets the needs of the student. It's also important that interpreters collaborate with educational staff. Interpreters can tutor students with appropriate training and supervision of a classroom teacher or a teacher of the deaf. An interpreter may be asked to pre-teach signs for content area vocabulary. If you're going to be talking about photosynthesis, it would be great if the interpreter had 2 or 3 minutes to discuss with the student. I'm going to sign it this way. Do you have a different way that you sign it? So they make sure they're choosing the correct visual representation for that vocabulary. And once in a while, you know, there's kind of that downtime in the classroom where students are working independently, which we want our deaf, hard of hearing, and deafblind students to do. Only when it does not interfere with communication access can an interpreter assist a classroom teacher or a teacher of the deaf and hard of hearing to create materials, to organize things, and to get the classroom right. Because remember, their primary role is to facilitate all of that communication. People often ask about if an interpreter can teach a sign language class. According to this guidance doc, interpreters can teach or co-teach a sign language club that is open to all students in a district. An interpreter may be asked to teach enrichment level sign language to students who are deaf, hard of hearing, or deafblind. Interpreters can provide information about deaf culture etiquette to hearing students and deaf students, but it is of note, a sign language interpreter cannot teach a sign language class that is offered for school credit unless they have the appropriate ASL teaching certificate. Professionalism. The same thing as for most people, but a few extra things to consider. When you're an interpreter, it's really important that you blend into the background. So your appearance should be solid clothing that is pattern-free and of contrasting skin color. You probably shouldn't wear 8 or 9 rings on your hand or lots of big dangly bracelets, because as students are watching those things, all that does is tire their eyes. It's more information to have to sort through. So the plainer that you can be dressed, the easier it is. And if you happen to be a person with facial hair, it'd be great if you could trim that back so that maybe we would have access to your lips to be able to speech read. Another area of professionalism is making sure that the interpreter has appropriate relationships, especially that interpreter-student relationship, understanding that boundary of what is friendly and what is friends, and how to really balance that relationship with the student, the general ed teacher, the teacher of the deaf and hard of hearing, and with administration. As always, confidentiality is really important. Our interpreters sometimes are privy to information that other people are not as privy to, and it's important that they keep that information to themselves. Linked at the end of this document, there is the Code of Ethics for Interpreters that could be utilized in order to draft some of those plans or to go over those policies with staff. The last thing I wanted to touch on just really briefly was all of this information is from the guidance doc discussing educational interpreting. Educational interpreters are used for students to access educational communication, including extracurricular activities, PE, recess, all of that jazz is really just for students. It is really important to note the certification for schools is very different than the community certification used in Nebraska. So if you have an adult in your building who needs access, maybe you have a parent who comes in for parent-teacher conferences, or comes in for a Christmas concert, or comes in to talk to the school nurse about something important, you cannot use your educational sign language interpreter to facilitate those communications. You must hire an interpreter that is licensed through the Nebraska Commission for the Deaf and Hard of Hearing. It's 2 very different skill sets that we're asking people to have, and most interpreters in that educational setting do not have a community licensure. The other thing of importance is sometimes you have situations where students who are deaf or hard of hearing or deafblind may be involved with law enforcement, or Child Protective Services may come into your building to interview that student about something that happened. That is not an educational activity providing access to educational communication or to extracurriculars. That is now a law enforcement issue, and that law enforcement needs to bring with them a licensed interpreter. It's really, really important that interpreters understand that and that administrators understand that. So much goes on in that law process that if you use a non-qualified interpreter, is now not admissible information. So if you ever have a question about law enforcement, or hey, this is going to be happening at my school, do I need a licensed interpreter or can I use my educational interpreter? Please do reach out to ESU 13, and anybody here in the Deaf Ed department can help you with that information, or reach out to your local administrator, your special ed director. They all know how to track us down to make sure that we're providing the legal access that is needed to be provided for those interviews. And then this is linked in your presentation, access to that guidance doc. Look, it's on there twice. It must be really important. So that top one, those 2 are the same. We'll get that fixed. There's the RID information, classroom interpreting handouts, and then the NAIE, the National Association of Interpreters in Education. their guidance doc on ethics and procedures. Do you have any questions about educational interpreter qualifications? It's a whole lot of information and you don't need it till you need it. So the great thing is this presentation will be out there, and in several weeks, there'll also be a link to a longer version of this sign language presentation sent out through Amy Rome's Friday Blast. Back to you, Pam. You're still muted, hon.
I think you'll unshare. All right. Well, thank you everyone for joining us for the related services guidance overview. I know that was kind of fast and furious, but if you have questions, please reach out to any of us at any time. And this information, I believe, will continue to be available to you if you want to review it, if you want to go over something. I'm going to go ahead and stop recording right now.